reported by World Health Organization and Alzheimer's Disease International, in every 3 seconds, there is one person diagnosed with Alzheimer's disease. As the aging population is expanding, dementia has become a tremendous socio-economic issue. Now, there are over 33 million people having AD. That accounts for 0.4% of the world population. The number of patients will almost double every 20 years, reaching 74.7 million in 2030 and 131.5 million in 2050. According to Hong Kong Alzheimer's Disease Association, 1 in every 10 local senior citizens aged 70 or above suffers from AD, and the number increases to 1 in 3 among those aged 85 or above. AD is an irreversible, degenerative brain disease that affects brain functions including memory, thinking, behaviour, and the ability to perform daily activities. At the moment, there is no cure for AD. The patients may require long-term care. AD not only affects the life of the patients, but also gives their families and society burdens. According to the 2019 World Alzheimer's Report, 75% AD patients' carers are often stressed, and over 50% feel suffered due to their caring responsibilities. Although AD is incurable at the moment, early interventions and timely treatment could help the patients to retard the progression of the disease and to prolong their normal lives. There are a few evidence-based early interventions that are effective in improving cognitive functions, treating depression, improving caregiver mood, and delaying institutionalization. Some of these interventions only work and work better when started earlier in the disease course. Therefore, early diagnosis of AD is important. Since the pathological changes in AD patients' body could not significantly appear until the late stage, clinicians or even the patient's family may not recognize the early sign of AD. Therefore, biomarkers could be helpful to diagnose AD at the early stage. Several biomarkers have been recognized and established for AD diagnosis with a high diagnostic accuracy of over 85%. These biomarkers could be found in body fluid like cerebrospinal fluid. They can be detected in laboratory settings or using enzyme-linked immunosorbent assay kit. However, these assessments are limited by the requirements of sophisticated equipment, complicated steps, and long assay time, and low sensitivity. CSF is a clear, colorless fluid found in humans' brain and spinal cord. It has to be extracted from the lower part of the spine. This invasive procedure may cause pain and side effects to the patient, and is usually performed by trained physicians in the hospital. Usually, as the patient develops the symptoms and go for diagnosis by CSF, this is at the middle or late stage. In order to address the issue, Professor Ricky Wong and Professor Lee Hong Wing from the Department of Chemistry of Hong Kong Baptist University lead a research team.
We had invented a new AD diagnostic kit that tests blood, saliva, or urine, providing a faster and more sensitive, affordable, and less invasive way than traditional method of detection.
Our detection assay only requires a few microliters of the body fluids to quantify the target protein biomarkers. Once the AD biomarkers is captured by the magnetic nanoparticles, an immunocomposite is formed. Then, the nanocomposite will be labeled by newly developed saline compounds and gives fluorescent signal for quantification. The intensity of fluorescent signal acts as an index to evaluate the severity of AD.
When comparing to commercially available ELISA kit, the new diagnostic kit provides another option for the patients and allows AD diagnosis using saliva and urine. In addition, even if the concentration requirement of AD biomarkers for detection is lower, it does not affect the sensitivity of the new kit. Besides, HKBU's new kit takes only 1.5 hours to obtain results, while the ELISA kit may generally take 18 hours. For a typical analysis, speed is one of the merits. It saves running cost. A shorter time allows future point-of-care products more feasible as well. Last but not least, the cost of the new kit is about $100, which is 50 times cheaper than the ELISA kit.
This technology has been granted a patent in the US. With this kit, we hope to lower the barriers for early-stage diagnosis of AD in order to help the elderly maintaining better quality of life by timely intervention.